We can't help but notice how significant AARP is in working on the many challenges that face older adults throughout our country, throughout our nation, and throughout Vermont, of course. And I'm really so pleased to be able to introduce to you Emily Allen, who is the Senior Vice President of Programs for the AARP Foundation. Throughout her career, Emily's primary passion has been on serving the needs of those most at risk in our communities. In her current role, Emily is responsible for overseeing the AARP Foundation programmatic portfolio that focuses on increasing economic opportunity and social connections for low-income older adults. Please join me in welcoming Emily Allen.
Good morning. It is a hard act to follow, but one that I'm thrilled to do so. You know, when you're invited to speak, you're never quite sure, you know, what if it's going to flow well, you know, and so I'm just thrilled by what you had to say and the focus on the issues of kindness and addressing issues of senior poverty and the interconnectedness between economic opportunity and social connection. So thank you. It's an honor to follow you. You know, this is the first time I've been in Vermont. I gave earlier that there's 6 states I haven't been to, and Vermont was one of them. So thank you, Janet, and thank you so much to the Vermont Association of Area Agencies on Aging. It's great to be here. Thank you to the sponsors. I know we do a lot of events, and I know without great sponsors, you don't have the opportunity to put things on. And so it's great to be here with you all today. I had an opportunity to talk to a few people when I first came in, and I was telling Janet earlier, I get the opportunity to travel across the country. And when I walked into this room and I saw the number of people are here that are truly focused and interested and excited and passionate about looking at and solving the problem of social isolation, it just warmed my heart. AARP Foundation has been looking at the issue of social isolation for about 7 or 8 years at this point, and so we're excited to see this kind of momentum and growing dialogue across the country. But even in the short time I've been in the room, I know this is a room of problem solvers. You solve problems every day. You don't think about it sometimes. It's for you, it's helping Mrs. Smith or Mr. Jones, but you're solving a problem. And I think it's this collective dialogue that can be so incredibly helpful. And my goal, as I go around to different communities and speak on these issues, is to, from a national perspective, begin to look and see where are their themes and where are their successes in these, more community-based dialogues that we can raise up to more of a national level. So I'm excited to be here with you today. I want to build on what Dave was talking about. A future without senior poverty and a future without social isolation. Let's take a minute to think about what a vision would look like. Because I think over today, and I've looked at the sessions that you are going to have, you're spot on to the types of dialogue that we need to have in order to really create that vision together. In this future, older adults would never have to choose between buying groceries and paying for medication. But yet I know that you see that every day in your communities. Between paying for rent or paying for heat. They would be financially stable. They'd have access to good, nutritious food. They'd have the strong social connections and stay engaged in their communities. They'd be able to get to medical appointments. We were just talking about that. Get to medical appointments and socialize with their friends. Their health would not be at risk as a result of not having enough resources or enough connections. They would have safe, healthy, affordable housing so they could live as long as possible in the place that holds their fondest memories. Excuse me, I don't know why I get choked up about every time we say that. We look at AARP Foundation, we look at all of those issues. So we focus on economic opportunity and social connection, in particular food security, income security. Do people have enough income coming in the door? Obviously the issue of isolation and the issue of affordable, safe, and healthy homes. But the fact of the matter is those are interconnected issues, and far too often, and I know you experience this as well because We're all somewhat beholden to funders. Each funder is kind of looking at each of these things in an isolated way. And so exploring the interconnectivity of these issues can be really a challenge. But the fact is that social connection is such a linchpin to overall well-being and addressing these important issues. At AARP Foundation, we truly do have a future that includes all of this and more. For those of you who may be familiar with AARP, I sit in AARP Foundation, which is actually the 501c3 charitable arm of the larger AARP. And we have a vision of a future free of poverty where no older person feels vulnerable. That's our North Star. And we do this with a mission of creating and advancing the most effective solutions that help low-income older adults, be they members or not, meet the basic needs in life. And so those basic needs track just along with what I was talking about: food on the table, good food on the table, food that you want, need, and deserve as an individual, social connections, safe, healthy homes, and enough income coming in, where economic opportunity and social connectedness are available to every older adult, regardless of geographic or demographic factors, where the quality of life and even life expectancy is not based on a zip code. Our collective work is important because 1 in 3 adults over 50 have an annual household income of less than $40,000, which puts them at risk of not having enough to meet their basic needs. Doesn't mean that everybody in a lower income category is not meeting their basic needs, but we know that, in fact, it could be one life event away. Maybe you're doing okay, but a spouse dies, or a health crisis occurs, or you begin to have a caregiving responsibility that suddenly life doesn't go as planned. You planned so well. And you know, I take exception. I've been in this space for a long time, and so often, when someone is struggling as an older adult, there's a sense or a tendency to kind of blame them. We would never, if a child was in poverty, we would never blame that child for being in poverty. But there tends to be a tendency in this world to blame older adults. You must have done something wrong. You lost that job. Well, why did you lose that job? Well, maybe you didn't plan well enough. You didn't save well enough. So we want to change that dialogue and move it away from blaming individuals that find themselves struggling, because guess what? It could be any of us at any given time. There's often a misperception, as we know, that older adults in America have what they need in the way of income and social connections. But the truth is that more than 37 million people over the age of 50 are either already in poverty or just one life event from slipping away. And 17 million older adults are experiencing social isolation. 10 million people over the age of 50 live below the poverty line. And this is interesting. I'm so glad you brought up workforce, because it is such a critical component. We think sometimes of people maybe who have lost jobs or taken a step out of the workforce, but the fact is that 13.2 million employed older adults don't make enough to meet basic expenses. So these are people getting up every day and going to work, sometimes working a couple jobs and still not making enough. And let's really bring this home, because I think part of what I try to do is give you all some thoughts and ideas and stats that help you carry that back to your community. So what does this mean? Certainly we know it means something on an individual basis. But the fact is that mortality rates increase as poverty increases, with the effect being most dramatic in 24 to 44 and 45 to 64. And we know that systemic gender inequalities that women face throughout their lifetimes are amplified by aging. As they grow older, women are twice as likely as men to be poor. Even older adults who are able to meet their basic monthly expenses can quickly lose their financial footing when confronted by events outside of their control. We know that financial issues, and I'm going to now kind of pivot a little bit and talk about how social isolation impacts some of these issues. We know that financial issues are actually compounded by social isolation. When social connections dissolve, the negative effect on mental and physical health is tremendous. We did a study a number of years ago that looked at the fact, and you may have heard this stat before, that being socially isolated is as bad as or worse than smoking 15 cigarettes a day on your health. Let that sink in. And there's such a passion around getting people to quit smoking and be healthier, but social isolation has the same impact as smoking 15 cigarettes a day. We know that social isolation is a growing public health concern, so we've got to rally individuals, health providers, health insurers, et cetera, to understand that there is an impact on their bottom line when it comes to social isolation. We worked with our AARP Public Policy Institute last year, and they did a study that looked at the fact that an estimated 4 million older adults enrolled in traditional Medicare are socially isolated, leading to an additional spending by the federal government of almost $7 billion a year. There's a bottom line impact on the Medicare system for individuals being socially isolated. 1 in 5 Americans 65 and older are socially isolated. Lack of accessible, affordable transportation, medical conditions, and other challenges can limit social interactions, as well as the ability to get to medical care and get to health and resource healthy food. But stating these contributing factors is a bit of an easy way out. Social isolation also stems from the fact that our society has moved away from placing a value on personal interaction with friends and family and neighbors, often in place of replacing it with technology. Our society has moved away from valuing kindness. I love that as you started talking about that, I'm like, oh, it's spot on. The importance of neighbors helping neighbors. Our skills for making social connections often erode. So I want to tell a story. Thank you so much for sharing the story of your grandfather. So I work for AARP Foundation. We focus on social isolation. I'm going to preface that. So I live in Alexandria, Virginia, just outside of DC. And we moved there, about 7 years ago. And there was an older woman living across the street. Nice neighborhood. And I would observe her. And I could tell she lived alone. I never saw anybody else kind of over there. And so I'm guessing maybe when I was leaving a couple times, maybe I waved. I'm not honestly sure if I did. I would see her out, give the mail. And I also knew that she must have worked I lived just pretty close to Mount Vernon. And I would see her, because they wear a particular uniform, walking. I live very close. So she would be walking either up to the bus or actually on a nice day would be walking up. But again, never said hi. Never, don't know her name. And one day my husband and I were leaving. It was in the morning. It was pouring down rain, kind of a day like yesterday. And I saw her beginning to leave. I knew where she was going in all likelihood. She was dressed and it was literally pouring. And I was coming down our driveway. And there was something, again, I work for AARP Foundation, we focus on social isolation, and there was something in my brain said, we should stop and offer her a ride. But I didn't. Something inside of me said, oh, I don't want to embarrass her, I don't know her name. That moment of kind of discomfort that you think, oh, I don't know this person, and they would be in my car, and the whole thing, for whatever reason, and you have those split-second moments where you can act or not act, and I chose not to act. And so we went on, and I'm sure she was fine. She had a big umbrella and that kind of thing. And a few weeks later, she passed away. And that has resonated with me so much because that is my story, and I'm sure you all have personal stories of really hitting home that here I am, I work on these issues, I know these issues, and something stopped me from acting. So I think, that's the message I carry to say, let's think why. Let's not just take it at surface value and figure out what stops us from acting. And how do we help neighbors and bring back that kindness. There is a direct connection between lower incomes and being at higher risk of social isolation. It's not a one-to-one per se, but AARP Foundation study by the University of Chicago recently found that income is in fact a significant factor in whether older adults are socially isolated and in their overall health, happiness, or feelings of loneliness. The finding was confirmed last year in a survey exploring loneliness in the United States in US adults age 45 and older. The survey found that nearly half of midlife and older adults with annual incomes of less than $25,000 report being lonely. This means, of course, that low-income seniors already struggling to secure the essentials are also at higher effects of negative health implications from feeling lonely or being isolated. They are more likely to have health problems, which can then lead to serious financial implications. So it's a vicious cycle we get into, isn't it? The burden of social isolation is even worse for low-income older adults from underrepresented communities. People of color, members of the LGBTQ community, immigrants, refugees, and those living in rural environments are already marginalized in society, and they also face disparities in accessing services or culturally appropriate care. So while we're looking at ways to prevent social isolation among all older adults, we're acutely aware of the challenges that confront marginalized populations and those living in poverty. In looking for ways to ensure that our aging population remains healthy and fulfilled through decades of what we once called old age, it's become clear to us the community, you as a community, need to be part of the solution. I have worked at the AARP enterprise for over 24 years. It's still so hard to believe. I'm usually the context setter in the organization. People want to know why we're doing something. Go see Emily. She usually knows, why we're doing it that way. And it's an understatement to say that during that time, during my 24 years, the world has undergone a lot of changes. So I reflect a lot on that 2+ decades. And one key realization is that the senior or older adult of the late 90s or early 90s when I started is not the same individual as the 50 or 60 or 70-year-old today. The world is truly a different place. And if the world is a different place and people are experiencing different challenges, then it's critical, now moving into the solutions discussion, it's critical that we look at developing solutions in new and different ways if we're to create true impact. When I took on my role a couple of years ago, I wanted to do, that was squarely on my mind. I wanted to look at how do we do things differently. Now, don't get me wrong, AARP Foundation has a great, outstanding track record, as I know you all do in your communities, of really making a difference. But I think it's incumbent upon all of us of looking at new and different ways of tackling these ever-growing challenges. About 5 years ago, AARP Foundation made a very purposeful decision to integrate innovation and lean startup methodologies into our program design and development to ensure that we had a highly rigorous process for identifying the right solutions at the right time, and to ensure that we were making the right investments in our work and supporting the work of other organizations. As we integrated this new process into our daily mindset, we had a few learnings, and I kind of wanted to share those with you. First, we'd sometimes been guilty of creating a really cool solution and then going out to find a problem for it to solve. People tend to fall in love with solutions, and we had to take a step back and say, well, that's really neat, but would anybody want to use it or do it or take part in it? So that was really a key component. Second, we realized that, often we think of innovation as like, okay, that's that innovation group over there, those social entrepreneurs. But it's actually, we needed to make sure that it really became a part of everyone's job, that everybody was thinking about what's the need that people are really experiencing. Let's dig into not just the surface need, but what's the underlying cause. That's nice, they have that need, but would there be a demand for the programs that you're offering? And so it was very important to make that culture shift to make sure that everybody was asking those questions as they thought of new programs to build. And third, we really had to align the talent and experience of our staff with our innovation mindset in order to achieve our goals. So we began to onboard individuals who had experienced or been part of social entrepreneurship and social enterprise development. And I know you all do this all the time, but at the center of our approach is human-centered design. We have to start with the individuals that we're trying to help from the very beginning, involve them in the conversation. And we've been guilty of the past of sitting around a really nice boardroom in Washington, D.C. and thinking of the coolest solutions that would work for me and my colleagues, but would not work for the very individuals that we're trying to help. So I remember the first day we did a big human-centered design experience where we invited individuals, low-income older adults from a variety of communities in, and just listen to them, listen to what they were experiencing. And you have to listen because we know, and you all know, I'm preaching to the choir here, that older adults are probably the last ones to raise their hand and ask for help in many ways. And so I remember we did, I was doing an interview with somebody. We don't presuppose a solution, so we were just getting to know them. And so started with the idea of, well, how did you get here today? Here we are in downtown DC and came from communities around the area. Did you have any problems getting here? No, no problems. Okay, well, tell me how you got here. Well, I got up at, I had to get up at 5 because then I had to walk to the bus stop and then I had to take 3 buses. I mean, so it just evolved that on the surface, it was no problem getting here because that was part of their kind of everyday life. But when you dug into it, it was like, holy cow. Think of the experience that, we had our at 10 o'clock meeting and they had to get up at 5 in order to be sure to be there. So that's the kind of dialogue that we tend to have. Each year, we aim to launch 4 or 5 new solutions that will equip low-income older adults with the skills and resources to increase their financial stability and help them stay connected to each other and to their communities. So I have a short video that I wanted to show because it actually does lead into one of the solutions that we've launched this year around helping people stay socially connected. A quick video that kind of gives a highlight of what we do. But you saw in the video an example of how we're using voice-enabled technology to improve the lives of low-income older adults in senior affordable housing. Just this year, we launched this program that's positioned squarely at the nexus of isolation and housing. Connected Communities connects low-income older adults to their senior housing communities by enabling them to access community information using voice-enabled technology. Now, this isn't something that we launched overnight, for sure. We had to do what we call sprints to determine first, would older adults even like this thing in their house? And so we test assumptions. So we made the assumption that yes, in fact, they would be okay with that, but we had to test that. We tested whether or not, okay, it's in their house. Would they use it? In fact, they did. May have used it for a variety of reasons. So slowly we began to evolve the fact and answer the question that in fact, yes, there would be demand. We answered the question about demand on the consumer side or the individual side. What we didn't realize is what a demand there would be on the part of resident services coordinators and affordable housing providers, because they saw it as a huge value proposition for them to reduce administrative burden on their staff for getting messages out to the community, for answering questions, things like that. So it's been an amazing opportunity to really look at how we provide value to not only the individual themselves, but to the housing provider as well. We developed a community hub skill that encourages participation in group activities by voice enabling a community's calendar of events and allowing residents to discover, register, and receive reminders for these events. There's also, and I know you all look at measurement all the time, we use a version of the Duke Social Support Index to measure whether or not, in fact, okay, there's an uptick in them participating in events, but is it actually having an impact on reducing their social isolation? So we developed a social check-in skill that administers the Duke Social Support Index at regular intervals to assess a resident's risk for isolation and provides proactive tips and recommendations about how to stay socially connected. All of this, as I said, is bundled with a web-based community portal that allows resident services staff to easily upload their community's full calendar of events and activities, which residents can then access through their voice-activated device. The portal also lets staff push out relevant information like notices and community news and alerts and more. In addition, we provide staff and volunteer training with a clear-cut curriculum and educational resources designed for older adults. We've launched this program in a number of communities, and we're looking to expand the reach of the program. During the pilot phase, we conducted baseline and follow-up surveys to determine the level of social support that residents perceived and actually received. Among residents who participated in the program, we were able to track measurable increases in social interaction. Residents who didn't previously interact with one another have formed new relationships and connections. They meet up to compete in trivia contests and listen to music. It's really interesting. You think of like the Alexa or other types of home devices as being in your home. They would actually bring their devices to a central room or something and have contests and listen to music together. And so we've really seen an uptick and an interesting use of this program. But obviously our interventions are not just focused solely on technology. We know that technology can be an enhancement, but it can't be a replacement for human contact. So we're looking at lower tech, more one-on-one processes. So, for example, we have worked with the Motion Picture Television Association, our fund, in California and throughout the country. When you think of motion picture television industry, you think of all the actors and we're all super wealthy and all that kind of stuff. But what you realize is there's a whole industry underneath this, or a whole range of positions and roles underneath this industry. Everything from costume designers and things like that struggle financially as they age and as they retire. And so we've worked on looking at a helpline or pairing volunteers who are in that industry with others who are struggling in that industry because it's a natural affinity there. So I know many of you are working on various kind of affinity group relationships, whether it's veterans or others. And so one thing that we've developed is, rather than everybody having to recreate the wheel, we provide some of the technical assistance and tools if in fact you want to get kind of a volunteer helpline established, or a volunteer match line where people work kind of one-on-one with individuals that may be experiencing isolation or loneliness. This is what we feel like innovation can do. And innovation isn't just the Facebooks of the world. Innovation can happen every day in community. This is how we're looking beyond what's customary, what's expected, how we can lift up communities with solutions and have real impact. This is how we can change vulnerable older adults from the face of poverty to the face of resilience. Because even those who slide into poverty and isolation through no fault of their own have an extraordinary capacity for resilience. You all see this every day, not just in terms of income, but also when it comes to navigating a disability or forming new social bonds. We need to change the typical image of a struggling older adult from frail and needy to adaptable and eager to succeed, because given the opportunity to thrive, they will. So what can you do now? That's what we're here all to talk about. I think it's exciting to see the sessions that you're going to have. A couple of things that I want to suggest. Many of you are already working in this space. Either you're starting something new or have programs that are addressing these issues. And we are really interested in learning more about what you're doing and how it's working in your communities, like I said, so that perhaps we can kind of pollinate this across the country. I encourage you to go to, we've started a platform around this issue called Connect to Effect, connect with the number 2, effect with an A, .org. And it's a place where it's a repository where we highlight different groups and what they're doing to address the issue of isolation. There's also a version of the Duke Social Support Index that you can use as a screening tool to have the types of conversations. If you're kind of new to this space, how do you even have the conversations with individuals? You don't want to start with, are you feeling isolated or lonely? There's kind of a stigma attached to that. But you can begin to think about how you ask the right kind of questions. Do you have people you could call in an emergency? Often individuals that are lonely or isolated, you can probably think of 10 people you could call an emergency right now, but they have no one that they could call. So it's those kind of proactive conversations. So we provide tips and resources on how to have those conversations. So I'm excited to continue to dialogue with all of you and listen to the information that you're going to share. And I just, again, want to thank Janet and her team and all of you for coming together to address this really important issue. Thank you.